Hello, I am Deja Hobbs, a sophomore journalism major from Chester, Virginia, and this is my midterm presentation on liver cancer. So, to start out, a little background information on the liver. It is an organ located on the right side of the belly, and its job is to activate enzymes, break down nutrients stored in the intestines that could potentially be dangerous or harmful to our body, and it also metabolizes fats, proteins, and carbohydrates. The liver is an essential organ that you cannot live without. You can live without pieces and parts of it, so you can have a piece of it removed if, say, it was cancerous, but the liver can also grow back itself. So, liver cancer is basically an overgrowth of cells within the liver. There are two types, primary and metastatic. Hepatocellular carcinoma is an example of the most common form of primary liver cancer. And primary liver cancer begins in the liver. And that's the difference between the metastatic um, type of it that begins in another organ and spreads to the liver. So here's a picture of the healthy liver cells versus the cancerous. And you can see the difference there. A couple fast facts about liver cancer. So 700,000 people die worldwide from liver cancer. Since 1980, deaths have doubled and diagnoses have tripled. So 30,000 Americans are diagnosed per year. That's 79 people in America diagnosed per day. And liver cancer is most common in sub-Saharan Africa and Southeast Asia. And this is the primary liver cancer that's most common there. And it is the number 5 top cause of cancer deaths among men and number 7 among women. So a couple of risk factors and causes and preventions for liver cancer. So long exposure to hepatitis B for a long amount of time, heavy alcohol use, heavy tobacco use, obesity and diabetes kind of go hand in hand, definitely put you at a higher risk of liver cancer because they all can cause cirrhosis, which is the scarring of the liver cells and tissues, which is one of the main causes of liver cancer. So the best prevention methods for liver cancer would be to make sure you're up on your hepatitis vaccines, not using alcohol and tobacco too heavily, and taking care of your health, your physical health, eating healthy and exercising and all of those types of things. So the signs and symptoms of liver cancer: unexplained weight loss, an unexplained decreased appetite, nausea and vomiting, enlarged liver or spleen, and that would show itself as painful and pain in the lower left or right side of your abdomen, abdominal pain and bruising or bleeding, which you can see is pictured here, and then jaundice, which is also pictured there with the yellowing of the eyes and skin. And also, liver cancer can cause some hormonal changes, and the side effects of those hormonal changes are high blood calcium levels, low blood sugar, and high cholesterol. So, detection of liver cancer, it's very difficult to detect it early because those symptoms do not show themselves until later on as you progress with the cancer. So it's very difficult to detect it early. The only people who are more likely to get it detected early are those who are at a high risk of getting it because they are getting tested regularly for it because they are at such a high risk. Detection is done by imaging scans, including MRIs, CTs, and ultrasounds. You can have a sample of your liver removed and sent off for testing, like a biopsy. And also, there is a blood test for a protein known as AFP. Now, this protein does not always show in all people with liver cancer, which makes it kind of unreliable. So it's best to do the blood test in conjunction with the imaging scans or the sample removal to be sure. Okay, so liver cancer is staged based on the amount of cancer in the body and how it has spread in the body. Its staging is based on the American Joint Committee Cancer's TNM system. And the T in this system stands for tumor, and that's basically the size and the number of tumors in the liver. Then the N stands for nodes, meaning has it spread to lymph nodes. And then M stands for metastasis. So that is, has it spread to, like I said, the nodes is for lymph nodes, but that's closer. If it's spread to distant lymph nodes or distant organs, then that's what the metastasis is. So there are 7 stages of how liver cancer can be staged. So you have stage 1A, 1B, stage 2, stage 3A, 3B, stage 4A, and 4B. Of course, 4A and 4B are definitely the worst stages of where it's progressed the most. Okay, so here I have a chart with the survival rates of liver cancer. Keep in mind that on average, the overall survival rate is 18%. So if it's in a localized stage, that means it hasn't spread, it's staying more contained, then the 5-year survival rate is 33%. Now, if it's more regional, it's spread to just nearby structures. It hasn't spread to those distant structures, like I mentioned earlier, then the survival rate is 11%. And if it has spread to distant organs like the lungs, then the survival rate is only 2%. There are various treatment options for liver cancer to increase that 5-year survival rate. You can have a transplant, you can have the tumor removed, you can have chemotherapy, radiation therapy, targeted therapy using drugs to target the area, and then ablation, which is a procedure used to just monitor the heart rate and make it more normal. So some of these treatments are not as safe as others, depending on your underlying conditions, and also depending on where exactly the tumor is on your liver. Because if it's located near a blood vessel, then the doctors might stray away from doing a removal and go a different route, maybe the targeted therapy drug route. So it's really just depends on your situation. It's on a situational basis, but these are really the treatments used to treat many other cancers. So it's really just knowing what's best for you and your situation. So this does conclude my presentation on liver cancer. I hope you enjoyed it and I hope you learned something new. Thank you.